embarrassed, but here I am, and let's get going. So I'm here to talk about our initiative at Nashville Public Library, Be Well NPL. My name is Elizabeth Roth, and I coordinate this program. So taking a look at Nashville and Davidson County, we're located in Middle Tennessee. We have a very growing population. We also have a very diverse population, both racially and ethnically. We have a number of people who are foreign-born as well as seniors, and then looking at people living in poverty, about 15%. But when you look zip code to zip code, really there are areas where over half of the population is living in poverty. So Nashville Public Library, we have about 21 locations serving this population. We're seeing about 4 million library visits each year. And we have a public library foundation that helps to increase the number of programming that we offer, both new ideas and being able to support and fund in that way. And so the Health and Wellness Initiative, Be Well NPL, really wanted to be in line with what are the health priorities of where we live. So Nashville or Tennessee has some pretty poor health outcomes, ranking 45th overall health in the country. Same with the city itself, being 45th compared to other larger metropolitan areas. We come out worse with our peer cities, or rank worse with our peer cities in health. And two of the things I wanted to focus on for this presentation, obviously, we're talking about physical activity, so what is the rate of physical inactivity here? And then some other health outcomes related, such as high blood pressure, diabetes. And so we see 29% physical inactivity. However, when we break it down by the census data to look at prevalence, you have neighborhoods where over half the population is reporting no exercise in the last 30 days. So how can we meet that need and really target those areas that are experiencing these also poorer health outcomes like high blood pressure? And of course, too, if you looked at this data and you mapped, what is the poverty rate in our county, you'd see the same shading areas. So really being intentional with where are we targeting our efforts and our money to really meet the needs of our communities. So we received a grant in early 2016 from Blue Cross Blue Shield of Tennessee to support us expanding our health and wellness programming throughout the county. We ended up choosing 6 target locations based on the data we looked at before, and seeing where is there, the higher rates of poverty, poorer health outcomes, and being very intentional with those efforts. So really, we're trying to increase the access to free programming, make it easier to get to and to participate in and engage people around healthy living and chances to experiment and try out new things. So we ended up doing, when I came on, we ended up doing a little simple needs assessment. What did people want to see? And the #1 response was yoga, and that really was across the board. And we did have some yoga that existed in a few of our branch locations. However, none of these 6 target branches that I talked about had any yoga going on. And so I actually reached out to a wonderful organization we have locally called Small World Yoga, which provides yoga to populations that otherwise wouldn't have access or wouldn't have been able to afford. And through this partnership, we've been able to expand yoga to our 6 branch locations, some of them offering 2 classes a week. We have specialized classes, gentle yoga for seniors in our locations that see a larger senior population. So that picture on the top left, you see that group of senior women at our Bordeaux community library. And those classes are seeing upwards of 20, 25 participants each week. So we've been able now for a year and a half to offer weekly yoga at those locations. Some of these other photos show our kids yoga. We have a staff person that leads a weekly yoga class at our main location. And with our grant, we've been able to purchase supplies like blocks and mats and wipes, and really have this mutually beneficial relationship with Small World Yoga, where we have broadened their audience, and then we've also been able to meet the need of our library community who wanted yoga. And so this is an example of our flyer showing the 16 classes that we now offer weekly at a number of our locations. Some other programming that we offer, gardening with children and adults. We have a seed exchange at our library where you can take out free seeds, which has been going on for a number of years. And then some locations complementing that with programming through master gardeners or other volunteers coming in talking about gardening. And then in this past 2 years, we were approached by Plant a Seed, which is another local organization that does outreach gardening with youth, to choose 2 library locations to implement after-school programming once a week through a grant they got with the mayor's office. And so we are having this program at 2 of our target branch locations where they come once a week. They actually installed raised beds on site, and the children are maintaining those beds and being able to participate in the gardening as well as cooking and all of that. And that's been wonderful because they bring in their own nutrition educators and are utilizing the library space and the audience as their program participants. We've also done programming around bicycling, and we have a wonderful group called Walk Bike Nashville here that, again, promotes and advocates for cycling and movement and walking around town. And they do free bike rodeos, so they actually bring a trailer and they've come to a number of our library locations and pull up with a truck, and they have bicycles and helmets, and they tape down a course and let the kids go through that with the bicycles. And they also do programming for adults, like City Cycling 101, where they come, this class in the photo, at the branch, they had an indoor class where they had a presentation on, rules of the road, and then everyone got to go outside and go for a ride together to practice what they had just learned leaving from the library branch. So we've done a lot of work with them as well, and that really is, for me, the point I wanted to emphasize is leveraging these partnerships of who exists out in the community that's, engaging people around movement and wellness, and then integrating them into the library, either with, programming or using our space to enhance what they're already trying to do. So just some other examples of programming we've offered: Tai Chi, Zumba, different fitness classes. We have a local person who started her own fitness class called Belly Tone, and she's now in a number of our branches. We have had health fairs at library locations where we incorporate like a fitness demo or give it a little try. So doing that as well, and then some of our infrastructure as well. This is a little climbing wall when they redid our children's area of our main library. And so taking into consideration movement and physical activity with our buildings as well. And one of our branches that was renovated, they put in a walking path around the library to encourage movement. We've done some story walks, or that's in the works to have story walks built, especially with land that's shared with our Parks and Rec, so working together with the community centers, Parks and Rec, to get people moving. And I wanted to say, too, that with all of our programming that we do on site that's fitness related, we always have people sign physical activity waivers, which isn't a problem at all with adults. They're always willing to sign. However, it can be a challenge with children's programming where maybe the parents aren't participating on site with the program, or the children are just there in the after school time. It has been more challenging to get those waivers. But for us, once someone signs a waiver, they don't have to sign it again. So for the children, if we can get it once, keep it on file, then they can participate in other programs. And then lastly, I wanted to point out some programming we've done outreach style-wise. This is our Open Streets event where they closed, well, the city's open streets were closed 3 miles of a road, and we had one branch that's situated on this route, and we put a table out. We had pop-up yoga that day with Small World Yoga. We brought the mats in the street. We also had a pound class, a Zumba class, just showing how the library is engaging around health. We're not there just signing up library cards. We were doing all these other activities as well. And then the photo with the table, this was at International Day of Yoga, which was in a park. The library had a presence there too, amongst, those people selling fresh juices and yoga supplies to show our yoga resources at the library, to promote our classes, and to, again, just be a presence there for wellness. And so just to take a quick look, our outputs, we've been doing this for about 2 years now, and I'm really proud of the growth we've seen in the number of programs we're offering, as well as the attendance that we're seeing, especially among the 6 targeted branches who are doing, a third of the programming, and that, it's increased threefold in both our number of programs and attendance over the last, from first year to second year, that we've increased that much. And then lastly, looking at our outcomes, because it's always important to be looking at, is this making a meaningful impact? Do people like what we're doing? So we did develop a survey from the beginning to assess some of these questions, and have found that there's been good satisfaction with the programs we're offering, that people want to come back to more programs. I get excited by the percentage of people who are hoping to make or intend to make a health behavior change based on what they learned. And this data that I pulled is specifically from classes related to physical activity. And when I looked back in and looked at, for people who said it was their first time coming and they were at a physical activity program, that it was actually 90% of people intended to make a health change. So just the fact that they're going to this class, learning something new, and showing that, maybe that they'll incorporate more movement into their life moving forward. And then most important to us is seeing what's the accessibility. Did people report that because it was free, because the location was conveniently in their neighborhood, that the environment was safe, that they felt it was easier for them to come? And so 98% reporting that accessibility was part of that decision. So thank you. My main really take-home points is to know, what are the health priorities where you live, being in line with what your city or town or region is doing, finding out what the need and interest is of your community members, leveraging partners that are already doing that work in the community, and really just inserting yourself as a library into these public health conversations, showing up to your health department meetings, local government conversations on health, just making the library be a part of that, and showing how we, we reach a large population, in need, and, how can we keep having libraries be part of that conversation. So if anyone has any questions, that was a real rush through presentation, but go for it.
Great. Thanks again, Elizabeth. That was great. And yeah, apologies again for the time zone confusion. Feel free to put some questions in the chat box, and I already see some coming in. But first, Elizabeth, I actually wanted to ask you a question that was asked of Jamie. And I think you may have an interesting response because we talked about this a little bit. With your yoga and other physical activity programs, have they all been led by outside presenters, or do the library staff themselves lead some of the physical activity programs?
Yes, we have one staff person that does a weekly yoga because she happens to be a certified yoga teacher. We also have a staff person that teaches a monthly Qigong class, which is a Chinese martial art movement. But for the most part, it is outside programmers. And that is a conversation that I have thought of having as, almost sending out a question to, we have close to 400 staff people. Is anyone certified in a fitness class? Is this something that would interest you? So it's a question that hasn't been asked yet, but we do have a few at this time, just on their personal interest they wanted to teach.
And Elizabeth, just a quick follow-up from the earlier conversation. With the people who do the Qigong and the yoga who are staff, are they paid extra, or is it just come out of their regular staff?
Yeah, it's considered
staff time salary. Okay. Yeah, that was just something that we were talking about earlier. I have a question now from the audience. So we have a question, Elizabeth and Jamie, if either of you have any thoughts on this. Do you have any advice for smaller or rural communities in identifying community health needs?
I mean, for me, this is Elizabeth. I would say, again, checking in with your your regional health department, finding out what they're focusing on, as well as if you have a hospital network, usually they will have done a community health needs assessment, and you could link into that as well to find out what some of those health priority areas are.
Okay, great. Yeah, thank you. That's a great point to tap into your regional or county health department. Excellent. Any other questions for Elizabeth or Jamie? Yeah, so if people are waiting to ask a question, Jamie had talked a little bit about in her presentation about also a project that was grant funded and some of the things that they're thinking about doing in Sonoma County as the grant kind of winds up. And Elizabeth, I wondered kind of with your project, what are some of the sustainability elements that you all will have to deal with in terms of keeping the momentum going and the funding going as well?
Sure. I mean, for Nashville Public Library, the grant that we received from Blue Cross was a 3-year grant, and the end of 2018 will be the end of that grant. We have had some extra money from local hospital system and healthcare company, but my intention with, again, finding these partners in the community was a way to build in that sustainability, that these partners, the larger partners I mentioned, they function under their own grants and are providing this service to meet their grant needs. And so it's a way to do it for us much more affordably, and to know that, that can last after this money runs out, or if this money is less, as opposed to just solely relying on paid programming.
Yeah, that's great. Kind of using the grant funding as kind of a catalyst, building partnerships that will kind of endure beyond the life cycle of the grant. That's great to hear. And I'm not seeing anything on the chat, so not to put you on the spot, Jamie, but Jamie, kind of listening to Elizabeth's presentation, do you have any questions for Elizabeth or any thoughts you want to share?
No, I'm just very impressed, and I've looked at what Nashville's been doing for some time now, and I appreciate them being a leader in regard to health literacy. I think it's fantastic, and I look forward to more, public and academic libraries doing these kinds of programs. I think it's really important work.
Great, thanks, Jamie. And I'm equally impressed. And Elizabeth, not to put you on the spot, but your background is in public health. Is that correct?
Yes, I had worked in a hospital system in a community health department for a number of years, and then left that role. And actually, when I saw this job posting, once I had moved to Nashville and saw a job posting for a community health position in a library, I thought, how amazing. I mean, that's truly community health work. I never thought I'd see something like that, but it really shows, I think, the creativity and forward thinking of this library system, of how libraries are key players in public health. So it's really been a pleasure, and just so important, I think, to be doing this kind of work in a library. And I think it's just going to continue to be more and more normal for this to be happening. But I was really shocked and excited when I saw this job posting.
Great, great. Yeah, that's really inspiring, and I'm hoping that moving forward there will be a lot more kind of cross pollination between public health, community health, and public libraries. There's lots of opportunities, and as Jamie and Elizabeth testify, also lots of amazing things going on. So I'm not seeing any more questions come in, and I do apologize again for the technical difficulties. I think we had a number of people that we're having trouble with the audio. And so just as a reminder, the recording will be available to you. And I also want to say that Elizabeth, and I'm not sure if Jamie, I should have asked Jamie this question as well, but I know Elizabeth is going to be at the PLA pre-conference Stand Up for Your Health at the PLA Public Library Association conference in Philadelphia, so you can look for her there if you want to follow up with any questions. And this is Elizabeth's contact information. And let me see. Let me see if I can find Jamie's slide really quickly. But if you want to reach out to Elizabeth or Jamie, feel free to do so. And yeah, I'm seeing some people thanking you both for your time. And look for your email for information about the next webinar. Please email with any ideas, comments, suggestions. And you can watch some of our past webinars if you want to learn more about library backpack programs, bicycles, yoga, parachute play, and a whole lot more. And if your library is moving, we would love to feature your story. Reach out to me. And thank you again to everyone for your time. And until next time, thanks again. And good luck with your programs. Goodbye.